So we've certainly had a roster of stellar speakers this morning. And as our last speaker, I'm proud to introduce yet another distinguished speaker, a member of the class of 1967. Alan Francis is a respected psychiatrist, and I think in some ways his talk may dovetail with that of Dr. Yaster a bit. Dr. Francis is a native New Yorker who got his undergraduate training at Columbia, and then graduated from Downstate in '67 and went on to psychiatry residency at Columbia and the New York State Psychiatric Institute. He was chair of the Department of Psychiatry and Behavioral Science at Duke, and he's founding editor of two well-known journals, the Journal of Personality Disorders and the Journal of Psychiatric Practice. He played a key role in the earlier development of the DSM, the Diagnostic and Statistical Manual of Mental Disorders, chairing the DSM-4 task force and participating as a leader in the development of DSM-3. Throughout his distinguished career, he has not shied from controversy. This is exemplified by the title of one of his earlier papers in 1981 in the Archives of General Pathology, Psychiatry, entitled No Treatment as the Prescription of Choice. No Treatment. A more recent book of his also has a provocative title, Saving Normal, An Insider's Revolt Against Out-of-Control Psychiatric Diagnosis, DSM-5, Big Pharma, and the Medicalization of Ordinary Life. I can see why Dr. Francis is a popular speaker and writer, and today we're fortunate to have him share his insights on saving normal, over-treatment in psychiatry. Alan.
First, just an addendum to the last talk. I think we shouldn't take pharmaceutical companies off the hook. They consciously started the pain as a fifth vital sign. They pushed it way beyond where it should have been pushed. Their advertising was misleading. Criminal charges were filed, $640 million in fines. Executives having to cough up some money. So we have some criminal doctors who've really contributed to the epidemic. We have lots of careless doctors who have contributed. But the background, the gorilla in the room is the pharmaceutical industry, and the government stayed way too silent, was way too passive in the face of this. I'm going to give a different talk than the one I originally, it's going to be a really controversial talk, and I'll just hit highlights so we can have time for discussion. Looking back at the arc of the last 50 years, as I see it, there's a complete disconnect between the absolute wondrous advances in medical science, molecular biology, imaging, genetics. It's unbelievable, beyond what any of us could have imagined possible. There's a disconnect between that and the generally lousy care we give to patients. The U.S. was recently ranked 70th in the world in preventing preventable deaths. In a survey of 11 peer countries as to quality of medical care, the U.S. ranked last of the 11. We consistently spend twice as much as the average of peer countries on medical care and have very lousy outcomes. We have a lousy system. Individual doctors doing great work, individual procedures that have been developed, wonderful, but if you look at the whole arc of the 50 years, we have a lousy system. Overpriced, under-delivering. The estimates vary, but about 250,000 people a year die from medical mistakes. Third leading cause of death in America. Now, why is this happening? Some of this is inherent. Some of this is, I think, the result of commercial forces. The inherent part is the inherent difficulty of translational medicine. That it's much easier to have basic science findings than to find a way to actually apply them to the next patient. Most striking in psychiatry, the brain has about 80 billion neurons. That's almost as many stars as we have in our galaxy. Each of them connects to 1,000 other neurons. Each of these fires a couple hundred times a second. It's an incredibly complex system. To think it's the most complicated machine in the universe. We'll never discover anything more complicated than the brain. It's amazing it works as well as it does, not that it goes wrong in some people. To think that we'd ever have simple answers as we thought 50 years ago. 50 years ago, psychiatry was pretty simple. We had a neurotransmitter theory. We had several neurotransmitters that accounted for psychiatric disorder. It was a lot like the humoral theory of Hippocrates. His theory, the humoral theory, had lasted 4,000 years. The neurotransmitter theory lasted less than 50. The brain is so complicated that every advance just broadens the horizon to how much we don't know. It will be decades before we have even the beginning glimmers in understanding schizophrenia, and eventually it'll be 300, 500, 1,000 different pathways. There will be no simple answers. How about the breast? If the brain is the most complex organ, the breast may be the simplest. I was at Duke when everyone was excited by the breast cancer gene being discovered. It's now 26 years later, something like that. Lots of progress, but the biggest gain in breast cancer life expectancy after diagnosis hasn't come from brilliant new treatments. It just came from redefining breast cancer and including things that may not really be breast cancer, as the introductals, as part of the disorder. We've dumbed down the definition of disease to get better outcomes. It's not going to be easy to solve breast cancer. It will not be easy to solve anything. The cancer cells mutate like crazy, and they develop the same kind of resistance as the bugs do. There are very few fields where we can say there have been grand slams. Stanley has a field, infectious disease, grand slams. For the most part, it's been walks, occasionally, but not many, singles, lots of strikeouts. And I think as we look to the future, we shouldn't over-anticipate a technological save for every problem. We have to look at our service delivery and see where that's falling down. Now, why does our service delivery deliver such crappy outcomes? In 1981, Bud Relman, who went on for about 25 years to be editor of the New England Journal, coined the term, or borrowed the term. The military, Eisenhower said military-industrial complex, Bud said medical-industrial complex. If you want to see a great movie, see The Hospital. George C. Scott, filmed in Metropolitan Hospital shortly after Stan and I left it. He predicted, Patty Chafsky predicted the medical-industrial complex in 1972. We have been shanghaied, corporatized, monetized, for-profitized. And at this point, the suits run the hospitals. The budgets go up because lots of extra procedures are done. And we have a problem in psychiatry, which you have in the rest of medicine as well, a terrible and cruel paradox in which we way over-treat people who get tests and treatments that may do them more harm than good, and we way under-treat people who are uncovered. In psychiatry, it's absolutely disgusting and a sad ending to my career. We have 350,000 severely mentally ill people in jail under the worst possible circumstances. You can't imagine what it's like to visit a solitary confinement area in the prison. Crap all over the place. The expression of someone who starts out a little crazy and gets crazier in a prison, the one expression they have is putting crap all over the walls, on the mirrors. And wherever you visit, it's the same thing, same expression. We have 250,000 homeless. Steve would be interested, has been interested in this for years. 600,000 people are homeless or imprisoned. We closed 600,000 beds in the last 50 years. We were supposed to provide community treatment for them. The funding was cut. No one cared about that group of people. There was cherry picking of the easier patients. The easier patients get way too much treatment. 20% of people in America take a psychotropic drug every day. 25% of women over 40 take an antidepressant. 7-8% of kids are taking a stimulant. Antipsychotics are way overused in kids and in the geriatric population. We have this terrifically stupid situation of over-treating people who are basically well and neglecting shamefully people who are sick. But you have the same problem. Obamacare was meant to solve this problem. It was meant to take the extra wasted resources and use them to cover everyone. Obamacare was sabotaged from the very beginning by